Heart is beating fast for no reason. Main causes. A fast heartbeat means that a person's heart beats at a higher rate than usual. There are numerous possible causes, including drug reactions, alcohol, and certain health conditions. According to the American Heart Association, the average adult has a resting heartbeat of about 60 to 100 beats per minute. A heart rate higher than 100 beats per minute is known as tachycardia. Most causes of a rapid heartbeat are not dangerous. However, a faster than usual heartbeat can be a symptom of an underlying health condition. This video looks at what can cause a person's heartbeat to beat faster and when to see a doctor. Response to strong emotions. Stressful emotions such as anxiety, anger, and fear can cause a person's heart rate to increase. When the body experiences stress, the adrenal glands release epinephrine or adrenaline. The body has two adrenal glands, one on top of each kidney. The body uses epinephrine to prepare a person for immediate action. Epinephrine can cause a person to experience increased heart rate, increased blood pressure, enlarged pupils, palpitations, or the heart rate can increase, decrease, or feel like it has skipped a beat. Sweating, anxiety. Generally, a person should find that their symptoms decrease once they no longer feel stress. Treatment. A person who experiences stressful emotions regularly may be at risk of developing certain conditions. The American Psychological Association note that chronic stress can increase a person's chances of developing certain conditions such as high blood pressure, heart attack, or stroke. A person may be able to manage their stress in the following ways: exercising regularly, engaging in relaxing activities such as meditation or massage, setting goals and priorities, speaking to friends and family for emotional support or help, talking with a doctor or healthcare provider. Response to certain drugs. Substances that can cause a person's heartbeat to speed up include caffeine. Caffeine is a stimulant found in many drinks such as coffee, tea, certain sodas, and energy drinks. Caffeine powder is also available as a dietary supplement. The Food and Drug Administration suggests that an adult could have up to 400 milligrams of caffeine per day, which is around 4 to 5 cups of coffee. However, the amount of caffeine a person can consume without adverse effects depends on their caffeine sensitivity. A person who has too much caffeine may experience insomnia, feeling jittery, anxiety, fast heart rate, upset stomach, nausea, a headache, a feeling of unhappiness. Alcohol. A study from 2014 found that even a small amount of alcohol can increase a person's chances of developing atrial fibrillation. Atrial fibrillation is a condition that causes a person's heart to beat irregularly and sometimes abnormally fast. A further study from 2017 tested people's breath for alcohol concentration levels. Researchers found that as a person's alcohol concentration level increased, so did their heart rate. Nicotine. Nicotine is a highly addictive chemical found in cigarettes. According to the American Heart Association, nicotine can cause increased blood pressure and heart rate. Research from 2016 noted that nicotine could increase a person's heart rate by 10 to 15 beats per minute or BPM. Researchers also pointed out that a person's heart rate and blood pressure increased regardless of whether the nicotine was smoked, inhaled, or ingested. Illegal stimulants. Illegal stimulants such as cocaine and amphetamines can cause a person to have a higher heart rate. Research from 2014 found that people who use cocaine are more likely to experience irregular or increased heart rates. Doctors sometimes use amphetamines to treat people who have ADHD or attention deficit hyperactivity disorder or narcolepsy. However, amphetamines can cause a series of side effects, including high blood pressure, elevated heart rate, a headache, dry mouth, abdominal cramps, nausea, vomiting, diarrhea, chills or fever, dizziness, tremors, restlessness. Certain medications. According to the United Kingdom's National Health Service, certain medications can cause a person to have an irregular heartbeat. These medications include inhalers, high blood pressure medication, antihistamines, antifungal medication, antidepressants, antibiotics. Certain supplements. Certain herbal supplements can increase a person's heart rate, such as bitter orange. People might use bitter orange for heartburn, nasal congestion, weight loss, appetite suppression or stimulation, and athletic performance. Certain studies state that it can cause rapid heartbeat. However, the results are inconclusive. Valerian. Valerian is a supplement used for anxiety, insomnia, depression, premenstrual syndrome, headache, and menstrual issues. Side effects of taking valerian can include heart disturbances such as a rapid heartbeat, headache, upset stomach, uneasiness, excitability, mental dullness, and insomnia. Ginseng. Ginseng is promoted as a general tonic to improve well-being. However, ginseng has side effects that can include increased heartbeat, insomnia, menstrual problems, breast pain, headache, digestive problems, and high or low blood pressure. Hormonal changes. An increase in heart rate may occur during pregnancy. This can happen because the heart has to pump blood to the placenta and around the body. A study from 2019 found that on average a pregnant person's heart rate increased by 7 to 8 beats per minute. The same study also found that the average heart rate increased throughout pregnancy. A person's average heart rate at 10 weeks was 79.3 beats per minute, which increased to 86.9 beats per minute by 40 weeks. Additionally, once a person goes through menopause, they have an increased risk of coronary heart disease. The British Heart Foundation notes that a person in the postmenopausal phase of their life may feel that their heart is racing. When to contact a doctor? A fast heart rate is not usually a cause for concern. However, an increase in heart rate may indicate that a person has an underlying health problem. Health problems that can cause rapid heart rate include overactive thyroid or hyperthyroidism, low blood sugar, types of anemia, postural or orthostatic, hypotension, which is dizziness or low blood pressure caused by changing position. fever, dehydration. A person should speak to a doctor if they have a history of heart problems. The increased heart rate goes on for a long time or gets worse. Their increased heart rate is causing them concern. A person should seek immediate medical attention if they experience shortness of breath, dizziness or lightheadedness, fainting, blackouts, tightness in their chest pain,